Good morning, everybody, and welcome to the It Takes a Valley virtual town hall. I am Michelle DeBose, Director of Community Engagement with Eagle Valley Behavioral Health, and I thank you so much for joining us today. For those of you who may be joining us for the first time, I'm going to provide a little bit of background as it relates to the virtual town hall. So in December of 2019, the Vail Health Foundation announced the It Takes a Valley campaign, Transforming Behavioral Health, to raise $100 million for EVBH and multiple nonprofits across the Eagle River Valley. In June of 2020, the foundation hosted the first ever virtual town hall as a way to share news and information, showcase partner nonprofits already doing great work in the behavioral health space, raise awareness about the campaign, and share ways community members can make a difference. Prior town halls have been recorded and are available on the foundation's website, which is vailhealthfoundation.org. And so you can go ahead and find those there if you're interested. Eagle Valley Behavioral Health has partnered with over 25 local organizations, including Bright Future Foundation, Youth Power 365, Mountain Youth, Hope Center of the Eagle River Valley, and others, many of which serve the Latinx community in different capacities.
Cheryl was never going to be there.
So today, we're going to be discussing the partner programs that have a heavy focus on supporting the Latinx and Hispanic communities here in the Eagle River Valley. Why is it important to have Latinx, Hispanic specific programs and services in our community? You know, the identity and culture of the Latinx community is incredibly rich and complex. There is really no one Hispanic Latinx culture, and this is true for our valley as well, where we have huge diversity within the Latinx population. Just in this panel, we have folks from Costa Rica, Peru, Argentina, and of course, we also have a huge population here from Mexico, right? So the Latinx community members make up a large percentage of our valley, which is sometimes not something people are aware, but 30% of our population and actually 56 of our school district identify as Latinx or Hispanic. In Eagle County, we have some of the highest rates of foreign-born individuals, with about 18% as compared to 10% across all of Colorado. And so why is this important for behavioral health? We know that bilingual patients are evaluated differently in English versus Spanish, and that Latinx Hispanic individuals are more frequently undertreated than their white counterparts. This can be attributed to cultural barriers such as differing values, the stigma surrounding mental health, among several others. Some of the mental health issues that present within the Latinx culture can be tied back to factors like acculturative stress, which is essentially the stress that comes from having to assimilate into a different culture than your own, with different values, you know, immigration, poverty, lack of documented status, and of course, fear of deportation, mixed culture household where the different generations within the household maybe have different or conflicting values, among others, which is why it is important to really address behavioral health within the Latinx community with a very culturally sensitive approach and wraparound services that really address social determinants of health, as well as other factors that influence folks' behavioral health. So we know nationally in 2018, close to 57% of Latinx Hispanic young adults, so between ages 18 and 25, and close to 40% of adults ages between 26 and 49 that had serious mental illness did not receive treatment. So 57% of young adults and 40% of adults did not receive treatment. And nearly 90% of Latinx Hispanic people over the age of 12 with a substance use disorder also did not receive treatment. So these are just some statistics to kind of show you a little bit about the differences and the disparities in behavioral health within the Latinx community. So today we're going to hear from 3 community organizations that provide various prevention and early intervention services with a wraparound approach to services. I would like to introduce you to our panelists, Bratzo, Melina, and Olga. There will be a Q&A at the end, and you may ask questions at any time using the Q&A feature. Please note the Q&A feature, it's not the chat function, so they're different. And then we're gonna just start and get right to it. I'll have each of our panelists do a brief introduction of themselves first and their organizations, and then I'm gonna move into maybe a deeper dive conversation with each of them. So Melina, why don't we start doing introductions with you?
Hi everyone, thank you for being here this morning. So my name is Melina. My organization is Eagle Valley Community Foundation, representing the MIRA bus project. So at the Eagle Valley Community Foundation, we provide access to program and resources to support wellness, healthier food, and other essential needs in our community while we embrace human dignity. So yes, so the MIRA bus, what is it? The MIRA bus is a 40-foot long RV. We seek to improve systems of delivery. We increase accessibility of community resources and services by bringing those programs and services directly into neighborhoods and community places. So how do we do it? We do it in a cultural relevant way. We are trusted leaders in the bus that go throughout Eagle County. While we do the work, we also collect data. So yes, so the data we collect is usually from the residents that live in a specific neighborhood. So when they come to the bus, they usually just come and check on services and resources, and we approach by asking them what is it that they need. We have this model of a bus, a mobile resource center, because we know that place matters. So this means that the issues that we see in Eagle County is specific to Eagle County. So it's not all over Colorado maybe, but we just take care of the needs in Eagle County. We also address barriers to access to these services. So we are a not traditional brick and mortar resource center, so we are mobile. With that, we address the transportation issue that most people living in maybe mobile home park or affordable housing or low income housing, people might not have transportation. So that's why we feel like going where they are it's been successful. We also have addressed the language barrier. Our staff is bilingual and bicultural, and being a multicultural resource center, we are also looking at our future, just adding more languages. So we are able, as right now, to address other languages rather than English and Spanish. The reason, another way that we are successful is because we try to be a one-stop shop for people that have those needs. Different needs, people that come to the bus, usually they have 2 or 3 needs or more. So if they have to address those issues, they have to go to 2 or 3 places, different places, but by just coming at the MIRA bus, we can just refer them to or connect them directly with a person in that organization or the process. So we are facilitating the navigation of finding those resources. And most importantly, just increasing the trust within the community that lives in those neighborhoods. A lot of people, we notice that one of the barriers to access to services is the trust to maybe governmental programs or maybe some other organizations. So by having a staff, the bus with people from the neighborhood that speak the language and they look like them, residents or our population come more often to the bus just to check in or check on out, or we create this rapport pretty much. So I think that is very important on the work we do. So far, we have been 3 years out there. And this year we noticed that there is a switch on the needs that specific to people living here. So, but always the three top needs remains similar. So the number one that people come to the bus is medical, secondly is food, and third is dental. And then we continue with health insurance and safety. That's how we work. So just keeping in mind that medical is the number one, we have been working with different programs through Eagle Valley Behavioral Health, Vail Health. Since the onset of COVID-19, we have been working on testing for COVID-19 in neighborhoods. Via mobile, we have had almost 250 COVID testing done. Now it's COVID vaccine clinics. So far we have administered with partners, of course, Eagle County Public Health and Vail Health and Clear Mountain Medical, almost 6,000 vaccines. Also, we are implementing right now a pilot for heart health and diabetes program that we bring that in the bus, and it's pretty amazing to see, like within 2 months, we have saw 160 patients. The goal for this program was to see 100 people in 1 year, and within 2 months, we already saw 160. So we are working on getting more support on just moving this program forward. So Vail Health and Clear Mountain Medical also supported the MIRA, and we are able to enroll people in health insurance through a Medicaid and Medicare insurance specialists, and if they don't qualify, we refer them to where they need to apply for. Throughout the summer, this past summer, we also work with the program Think First. Is a injury prevention program through Vail Health, which we were able to distribute in different neighborhoods to kids or their parents 122 helmets and teach them and show them, how to wear them correctly and just be more. And with this also come the pedestrian education, biking education piece. And with behavioral health, we have had the behavioral health navigators at the bus and doing referrals to those services providers that the people don't know where to go, how to call, or how do I do this? So we have counted like at least 90 referrals have been made through the MIRA and the navigators. And lastly, but not, we also brought some nutrition and physical education through Our Head, which we pilot a group of 10 mothers in this case. They were coming for a few weeks just to know about nutrition and physical activity. And all these have been done outside the bus, right there where they live. So it's been shown that it was successful so far. So building trust, how do we do this? We try that our relationship with the patient or client that comes to the bus, the resident, is positive. We connect with them in person, via phone, social media. We follow up with them, and especially after hours. We try not to be in neighborhood on office hours because that's when everybody's working. So we try to be after hours. We build rapport and also encourage them to take action. We have conversations in the bus. We start with the needs, and then what is it that you're doing, or how can we help you? And then we just encourage them to take action and then come back to us so we can address the second need. The referrals to other organizations, we do. That also is a way that we create trust because they trust us, and we refer them to, let's say, to a doctor visit or a dental appointment. They feel that they are supported. And we also offer a space to share their stories at the bus. Sometimes they just need to let us know what happened to them specific and validate who they are. That's why it's so important to us, just the relationship building that will go into trust, and then just the rapport, the follow-up. We know that if we provide, there is an assumption that if everybody receives the benefits of the same support, we're going to have the same outcome. So we at the MIRA, we believe that everyone gets support, and the support specific to their needs. So that's why we make like this work, equity work, is specific to them. Yeah, so I don't know if you have any question, Michelle, but I think I can go on and on. So
yeah, you covered a lot of ground, and thank you so much. We're going to probably have some time for additional Q&A after, and I think now it's a good time, Bratzo, if you would want to take the floor and share a little bit about your programs and what you do at My Future Pathways.
Absolutely, thank you. My name is Bratzo Horruitiner. It's not a tongue twister. That's what it is. I'm from Peru. I've been here in the Valley for about 20 years, and I work for 2 local organizations, and they work in conjunction with a shared mission and know-how. They are My Future Pathways and Guardian Scholars. And what we do is we serve and support the Eagle County youth and their families who are primarily Latinx or Hispanic in a holistic way to help them meet their full potential. Using a 3-pillar approach, we provide social and emotional support through mentoring. And then we also do academic support to tutoring. And then we do scholarships and physical education and wellness through sports classes, and expose youth to try to close that opportunity gap. And we can talk a little deeper on that, but that's a little bit of our scope. We are a local nonprofit and provides opportunity, number one, for our students. We currently doing 10 mentoring sessions per week, which that's our initial piece. And we have kind of a similar strategies like Melina has, because our first approach is to build trust. When trust is established, and then we also expose the kids to that mirroring effect. All our employees are Latinos from this community, then graduate from high school and college, and now they are leaders in the community giving back. So all the kids kind of reflect in them. That's the mirroring effect, and they can see what they can achieve. So doing that, we start building trust. We work in our mentoring sessions in the entrepreneurial mindset. We talk about it. Values, family values, very, being culturally appropriate, and then we build trust that way, and then we move into what it takes to be successful, what it takes to be that entrepreneurial mindset type of person, and then we move into the academic achievement, and then with that we move to the last piece, which is mental health, physical activity, and all that. And with that, we do a lot of prevention education, and that's kind of the topic today, is talk about how we contribute to mental health in the systemic way to looking for change. And we are building capacity. We have right now 2 youth centers that provide a physical, safe environment for the kids, so they can go and just be kids and be supervised and having a safe environment. We have access to many things in those youth centers. One is in Edwards, one is in Gypsum. So we can try to talk about the transportation challenge. So we have a 1 youth center in every in every side of the town. And we provide, we have a computer lab. We have access to internet so the youth can go and do their homework, pull applications to college, finish homework, get access to internet. And then they can have a good time as well by playing video games, so ping pong, football, those type of things, and just kids being kids, right? Then we also have the cool part also on this prevention education. We show the kids a future pathway, a pathway for a positive life, and that can be many things, right? Many things for everybody, but to do in this holistic way, we do wraparound services around the kids. So we can be a little bit more comprehensive of what they're going through. We're not building an algorithm. We work with kids one case at a time. We are all people and we are all different. And whichever the situation is, we are ready to respond or redirect. You know, we are not experts in everybody, but I can always call Olga and bother her a little bit, and vice versa, right? So building those relationships with the community and other entities is super important, and that's where I definitely celebrate all our partnership, especially with Eagle Valley Behavioral Health, as a funding agent, as a guidance, and as an intermediary between all of our organizations. We also have college scholarships. We have 33 students currently at CMC. We are a comprehensive scholarship. What does that mean is we try for the families to don't pay $1. And that way we go around and we look for money and services, you know, first of all, so the kids can graduate debt-free, which is huge. Everybody that is a parent know what does that mean to them, especially for their wallets and their you know, and their family well-being. But we also working to mitigate or increase the graduation rate, not only in high school, which is almost 50% of the Latino boys don't graduate high school in our local community in Eagle County, and 11% of first-generation Latinos do not graduate college in America, in the country, which is for every 100 students that we send to college, only 11 graduate. And with us, because our system around the kids works so well with Guardian Scholars on My Future Pathways, we are able to graduate north side of 92%, 92, 95% of our students. And the remaining 7% is because of mental health issues. So that's kind of a little bit of what we do. We have currently 33 students at CMC, as I said, 48 students at CMU, is Colorado Mesa University in Grand Junction. And we started a new scholarship for trade schools, and we are sending our first 3 students in January to start working in trade school and open that avenues as well, a little quicker and not the traditional way. So that's a little bit about what we're doing in the scholarship pieces. We also, in another amazing partnership, and I jump in the gun here, probably on the celebrations for later, but we also graduate 4 students with their Masters of Social Work with in partnership half and half with Eagle Valley Behavioral Health, with the purpose of creating capacity and provide bicultural, bilingual mental health providers in the Valley, which is so needed. So that's a little bit of a glance, and I will pass it back to you so we can carry on.
Thank you, Bratzo. That's an amazing overview. So we're kind of going backwards a little bit with we started with Melina and MIRA and the Eagle Valley Community Foundation, kind of talking about, you know, they serve the larger Latinx population. Bratzo really focuses on that adolescent and youth population. And now we're going to hear a little bit about Olga Wilkins, who works with Early Childhood Partners. And they focus on the younger kiddos in our community. So Olga, why don't you take the floor?
Thank you, Michelle. Yes, so I work with Early Childhood Partners. We're a nonprofit that has served the Eagle River Valley for the past 18 years. We are a group of mental health and early childhood development professionals, and we focus on supporting young children and their caregivers. We go directly into their homes, their schools, their childcare centers, and we use nationally recognized and evidence-based programs like Promoting Safe and Stable Families, the Incredible Years Parenting Class, Lena Grow, the Family Leadership Training Institute. And we focus our efforts on children's ages newborn to 6. Like Michelle said, we go to really, really young. That's a time when the brain development is peaking. Behaviors are being learned. The brain is more malleable. We can work more easily with children when children are actually first introduced to school. We offer a different array of services to families, and we work with families as well as with the professionals that work in early childhood with young children, like I said, like from the ages that they are recently born, 6 weeks, when they can legally go to childcare, to 6 years old. And something that people don't know is the Early Child Partners serves over 60% of the families that we serve are families that are Hispanic. Last year, for example, depending on the program that we work, we have a more heavy presence of Hispanic families, but our resource centers serve over 190 families, and 95% of those families were Hispanic. And something that I also wanted to mention is all of our services are free of charge to families. Thank you to the grants that we receive from foundations, so that there's no barriers for families. There's no cost that will keep them away from us.
Wonderful. Thank you so much, Olga. So Melina, we're going to go back to you for a little bit, and we have a few questions to follow up on some of the programs you've mentioned. So we know that if basic needs are not met first, and you talked a little bit about this, right? But if basic needs are not met first, we really can't address the mental health of our community. So we're just curious to learn a little bit about what are you seeing in the community. What relationship are you seeing in the community between the lack of access to basic needs and services and the prevalence of mental health issues, particularly in the Latinx community?
So what we see in general is the lack of knowledge on the system navigation. One of those, some people don't know where to start. So when they come to the bus, that's the starting point for them. And then when we want to make referrals, it's also hard to get the appropriate provider that might understand the culture or might understand, you know, all the trauma from the past. That is, you know, the Latinx community that we see here in Eagle County is first generation, and the second is growing. But the first generation, they have a lot, they went through a lot. So, beside the language, the cultural.
Oh, sorry, Melina, I think we're having a little bit of connectivity issues. Can you hear us? Maybe we can give it a minute.
Services. To us as more strong ones. So that's how we can address those basic needs as well, just by following up.
Okay, I think we had a little bit of connectivity issue there. So we're going to pivot, and maybe Bratzo will go to some of your questions, and then Melina will come back with some additional questions once the internet is a little bit more stable. So Bratzo, you shared a little bit about the programs and services that you offer at My Future Pathways and their impact. We're curious to hear from you about, we know that the past few months throughout the pandemic have been incredibly difficult for our youth. The Denver Children's Hospital even declared a state of emergency for youth mental health this year. So we'd love to hear from you. Can you share what you're seeing and what are the most prevalent mental health issues or behavioral health concerns within the population you serve? And do you think those problems are perhaps exacerbated or heightened within the Latinx youth community?
Yes. Well, I'm going to quote Chris Lindley. I heard him say it in one of the presentations that he did. It's sad to see kids going to the emergency room for mental health issues in that type of volume. You know, when we were kids, we were going to the emergency room because we fell off our bike and we had scratches and maybe broken arm. That was definitely me. But now the mental health issues are the predominant problems in the hospitals, which is very alarming and super sad. Nobody ever want to hear their son or daughter talking about suicide ideas, and that's a local reality right now. So that piece of prevention education providing a safe environment with the kids was our mission and our first goal through all this process, because we see the need of the kids to socialize, to kids being kids. And of course, the challenges in academia, in doing their homework, in have access to internet, in have access to a computer. Not everybody have access to everything. We a lot of times, we make it for granted, like everybody live the same way or have access to things. So access to things was definitely a big challenge, and by us being able to provide the youth center in Edwards with tutors, with teachers, with middle schoolers helping each other's in a peer-to-peer base. Our model brings college students to help high schoolers to help middle schoolers, not only in the academic piece, but it's also in the social part, where 8th graders moving to 9th grader and being new in a high school is always a challenge, and being in a new environment for everybody can be daunting. So creating those relationships and that peer-to-peer support was super important for us, for our organization, and for the mental health. And I'm super proud of my team, because they didn't hesitate and show up to work with a big smile, no matter if you see it or not because of the mask, but providing a safe environment. And we were pushing to do outside activities and force ourselves to do also some really good partnerships. For example, I want to talk about SOS. We were able to take our kids to snowboarding and my Future Pathways with their model, with their instructors, access to snowboards, passes, instruction, and transport. We provide transportation, and we went and snowboard with the kids. So they were outside having fun, enjoying their environment. And then we went and we did a walk with walking mountains through the snow, a snowshoeing in the moonlight, which was unique and fantastic. And we were trying to do those type of things, right? Promote activities, physical activities, and that sense of belonging. A lot of times our youth don't, especially the Latinx, because they're trapped in the middle of in the two cultures. They go home and they live in Latin America, and then they step on the door, and then they start speaking English and they become American, which is great. And but it's an interesting dynamic. And and a lot of times the kids don't feel like they belong. And socially, right now through social media, everybody lives their perfect life, and all the factors that we all know, in social media and this era of communication can be amazing for everybody, but also can be challenging for socialization, especially among youth, where they try to proclaim these perfect lives and try to live this second type of life, the real life, but the one that they want to project. So that's a little bit of the issues that we saw on mental health, and that's how we try to address them. Mm-hmm.
So Bratzo, another question for you is, we know you aim to work really with the whole family. So can you share a little bit about why it is important to have a 2-generation approach, and what services you offer to engage the youth's parents and other family members?
Absolutely. So the fantastic thing is we are family oriented. The Latinx community sits around the table. We are loud, we celebrate, we talk a lot, we put music on, and we eat. So it's important to provide food into all our activities. That's one of our strategies and our model pieces too. But the 2-generation approach is huge. A lot of times we have a lot of migration from rural Mexico with low levels of education. That's what we discovered. Of course, it's not it's not a generic assumption here, but we have a lot of that. And what happened is the value of hard work is the #1 value, especially on Latino males. And this value is such a blessing and also a curse to be able to pay that much money to a young guy. So let's go. They offer $20 per hour in some of the restaurants to becoming a dishwasher. What I'm saying all this is because the #1 value in a lot of our families is hard work. And the things that we give to our sons is our trade, I'm going to show you how to work hard. I show you what I can do. Let's say I'm a framer or I'm a woodworker, and I can show you my trade. And that's kind of my legacy to you. And then we value the hard work upon everything, the #1 value being hard work. And we start pulling our kids out of the school in 7th grade. so they can start learning those things, and then they can start making money, and the value of money becomes the number one thing, and the value of education becomes on the bottom. So what are we doing on My Future Pathways? We don't say one value is stronger than the other, but we are leveling the ground and changing that paradigm so we can equalize the field. And then we do a lot of parent events. We invite parents so they can be supporters of our efforts. So what we say normally is like, you guys drive the car, but sometimes we can be the GPS to tell you, hey, maybe there's a better direction to take a right here. Hopefully we are not dyslexic, but that's what we do. We provide information, opportunity, resources to our families. We also did a class that is called Familia Adelante that involved parents and youth going to have the same exposure to the curricula, but in two different spaces. So we go and talk to the parents, and we talk about acculturation, stressors, relationships within the family, how to navigate certain systems, talk about anxiety, mental health issues, drug and substance abuse. And the youth are receiving the same message in a more of age-appropriate curricula design in a different room, and then we promote conversations. That's one of the things that we do, but we focus a lot into bringing families together and have the approval of the parent, right? If the parents are the ones who are making directions, and we just support in those directions and open opportunities. Mm-hmm.
That's wonderful. Thank you so much, Bratzo. So last question for you, and then we'll pivot a little bit and move to Olga. But as part of our workforce development efforts, we know that we have one of the biggest issues that we have here in this community is that we really do not have enough behavioral health clinicians in the Valley, right? Especially to serve the Latino population, so that are bilingual and bicultural. And so as part of our workforce development efforts, EVBH and MFP partnered to provide an MSW scholarship and a loan repayment program for local behavioral health clinicians. Can you share a little bit more about these programs and their impact? And you kind of gave a little bit of a preview earlier today, but it would be great to hear more about the Master of Social Work program and those programs that we're developing together to really help increase our local clinicians.
Absolutely, yeah. Job rotation, hiring is an issue for sure. We all know right now everybody's looking for people. Work become a problem, right? And so we produce together, because it's a long effort from a lot of people in the community, these amazing ladies, Latinx, bicultural, bilingual, local young females, then they understand the problematic. They are being daughters of immigrants, and we have right now 5 Masters of Social Workers, Cassandra Armas being the first one to kind of start this way, and now she works in the schools. We have Rosa Gamboa, who works as a victim advocate for the Eagle County government. We have Coco and Gladys, and work with you at Eagle Valley Behavioral Health, and supporting the paramedics into those mental health phone calls and visits, and aligning resources for families and being navigators for open opportunities and resources for our families in need. And then we also have 2 more in the pipeline, Carmen Castillo and Diana Bonilla, Diana's from Costa Rica, Olga, I don't know, you probably met her. And then Carmen is from Mexico. Amazing young ladies, super smart, super professionals, and they have that empathy that is unique. When you have it, you have it, and that's what we need: more empathy, more understanding of social determinants, trauma, so we can address things better and guide these people a little bit better. We also got the loan repayment. We allocate $100,000 through a pass-through management partnership opportunity with Eagle Valley Behavioral Health, and we were able to support 14 local mental health providers by paying their student loans. So it becomes another benefit, because living in this community is so expensive, and it's hard to get housing and just to thrive and stay here. That's one of the determinants why we have such a crisis right now, is the high cost of living. So by doing so, we are also it's not only a recruitment tool, but we just keep them here, right? It's a commitment for 5 years, up to $30,000 per recipient, which is kind of translated to $500 a month to their loan, to the student loan that we pay directly to the providers. And that way we just make it a little easier, and we thank them for the job that they're doing. We have, through the Guardian Scholars Program, we are able to graduate an enormous amount of professionals, mainly Latinx, bicultural and bilingual again. And then we have people working in the police department. We have Alan Hernandez, which is a detective. We have a lot of people working at the hospital, the county, and my future pathway just graduating some teachers now, which is amazing. I've seen Jonathan Cerna becoming an elementary teacher, and then we have Jimena Ojeda, we have Leslie Chavez, and they're studying social work at Colorado Mesa. And then hopefully we can maintain this rate of success, and we can still providing these opportunities for them to get their social work and then their licensure, so they can start doing therapy and providing more extensive supports.
Thank you. And I'll just add too, I think one of the amazing things about the Master of Social Work program is that it leads to a license of clinical social work. We're supporting these young students to really kind of go through that whole pipeline until they get their licensure. So we're supporting them every step of the way. And LCSWs are reimbursable by Medicaid as well. So there's that one piece that really allows us to ensure sustainability as well for the services that they will be providing. But it's just really fortunate that we've been able to partner with My Future Pathways to support growing our own local clinicians that understand not only the culture and that have the language to support Latinx individuals, but that also understand the particular challenges that exist within this valley, which are different from even the challenges that exist in neighboring communities. So we're really fortunate to be able to focus on this. So let's pivot a little bit, and Olga, let's have a chat with you. So I would love to hear a little bit more about the different programs that Early Childhood Partners offers and the areas that they address.
Yes, Michelle, thank you. So we offer different levels of services, from prevention to intervention. We offer parenting classes, individual parent coaching sessions. We also offer home-based family support. We go into homes and work with the families in their homes. And we offer early childhood mental health consultation for both families and for childcare providers. And for childcare facilities and providers, we also offer childcare. We also offer trainings in social emotional curriculums. And when a childcare center, for example, has an issue, they are wondering how they can best support a child, or how they can best support a family. We are the people that they call to meet and consult, and also meet with the family, facilitate the conversation, or determine if a child needs to be evaluated or not, to see how they can best be supported. We also have, besides all of the services, we have our resource center. It's called Family Connect, and it offers wraparound services and supports for families. And the services that we provide to each family is individualized. We have families that call asking on, how can I help my child with wetting the bed, or how can I handle tantrums better, or we are going through a divorce. Can you guys give us some support and how to talk to our children about this? And we also have families, especially this past year with COVID, they call asking for support with basic needs like housing or accessing food. So we refer and connect families to those organizations through the resource center. We saw a lot of that last year, and we know how important it is to help families respond to those stressors so that they can then be available to respond to the emotional needs of their children. We offer one-on-one mental health consultations. And like I said, we do that for parents and children. And more recently, we started providing intensive case management. We work with families with their needs once a week for at least 3 months. And like both Bratzo and Melina mentioned, our families in our community are under, especially after COVID, but not only because of COVID, under so much stress. We have a high cost of living, high cost of childcare, high cost of medical care. So usually we have 2 parents working and families needing a lot of support in meeting the social and emotional needs of their children. And with the intensive case management, we can help them not only address the needs of their children, but also what else is stressing the family. What do we need to connect them with? Like Melina mentioned, sometimes families need access to health. Families need access to understanding what supports are in place in our community to better support their children. Sometimes families need help paying the bills, paying for cable, or being able to repair the tires in their car so that they can show up on time to pick up their children. Sometimes they need help paying for bills so that their phones are working, so that they can communicate with the schools. So with the intensive case management, we're able to support families in a more extensive manner. And we have been doing that since the creation of our resource center as well.
Thanks so much, Olga. And I think what you mentioned is really so important, because what we really see in this community is a very high needs Latinx population. There are so many needs. And so really thinking that just by connecting somebody to clinical services and to attend therapy or participate in therapy services, a lot of times it's not enough. And there needs to be really that wraparound approach to care, which all 3 of our panelists today have kind of talked a little bit about that. How do you work with the entire family? How do you ensure that they have the resources and services they need to address those stressors that are there on a daily basis, in order to then be able to also focus on their mental health needs? So I really appreciate you bringing the case management program up. I think that's super important. Olga, so another question for you. We know that Early Childhood Partners really focuses on providing mental health services to the youngest members of our community. And some people might not really know about this. So can you share maybe a little bit of why it is so important to address mental health? Mental health issues start early in life as well. So why is it so important to address mental health issues for those very young kiddos in the early ages of the lifetime?
Yeah, so we have now extensive research that supports the work with early in life with families. Most people know by now, I assume that 90% of brain development happens before age 6. By age 5, almost the brain has grown to almost the adult size of an adult brain. So when we are working with young children, we're able to intervene at an age where all those connections are happening in the brain. Most people don't know, and people think, oh my gosh, what are you doing working with children so young? But children that I identify with behavioral issues by age 3, 50% of those children when they get to kindergarten or first grade receive a psychiatric diagnosis. So if we're able to intervene early in life, it's between those ages of 0 to 6, we're able to address the needs of the child when the issues are just starting and the patterns of behaviors are not there, when the brain is very malleable and we can respond in a very cost-efficient manner. One example that I am thinking about is just recently sharing with a family we have been working with. The father was sharing how frustrating it was for him when his child, it was then probably 2.5, the dad had purchased a trampoline. And the child wouldn't jump in the trampoline, and kids that were a little younger in the family, cousins and neighbors, were jumping in the trampoline, and how this was creating so much frustration for the father. And through the early intervention that the family received, they found out that the child had all the sensory issues. So being out of balance and not feeling his feet in the ground caused the child a lot of panic. Also, the child was very sensitive to certain textures, noises scared him a lot. So the mom was sharing how the father, up until they received the support in the diagnosis, was talking about his child like he's fearful, he's too shy, he needs to be more of a man. And since they received the diagnosis and the father was able to understand, oh, he just needs a little bit more time to warm up. Oh, his nervous system is still too raw. Those sensations bother him more than they bother other children. Then that relationship between the father and the child was continued. The father was able to support the needs of his child, waiting for him to be ready to flourish. And now the child jumps in the trampoline and loves to jump with his dad. And there are little interventions like that, that if they're caught early, it just seems like it requires a little bit of work. It maintains the good, positive relationship between the adult and the child. And then the child doesn't grow up with those labels. This child could have grown up with a lot of labels. The relationship between him and his dad could have been disrupted from an early age. And now that has completely changed the course of the life of this child. So that's just one example of how early interventions can prevent someone from developing later, like a panic disorder or some anxiety disorder. And just to finish, early supportive relationships are absolutely essential for a child's healthy development. So when we intervene early with the families, we're able to ensure that those relationships are there to help the normal development of that child.
Thank you, Olga. And really, early childhood partners, it's just so fabulous. You guys are able to work with a whole host, like in a wraparound approach with the families, with the parents, but at the same time, you're also working with primary care settings and childcare. So you're really able to kind of wrap around that child and provide a whole host of services to make sure that they have the best start in life possible. So we're going to pivot back, Melina, to you and just ask one follow-up question. You talked a little bit about this, but I'd love to dive a little bit deeper on this. It sounds like we have better internet connectivity now. So we know that COVID-19 had a really huge impact on mental health across our community. Anxiety levels rose. There were considerable barriers to access and to preventive care, including vaccines. And so I'd love for you to share a little bit about what MIRA's role was in supporting this situation.
Well, thank you, Michelle. So COVID-19, since the onset, it's pretty obvious and very much known that the Latinx community was in disadvantage on getting the information to understand where to go for testing, for vaccination. Especially, we got into a crisis. So people that live in crisis, like I don't have food or a meal for my child this evening on a regular basis, adding the COVID-19 crisis added a lot of stress and also uncertainty. So people didn't know what's going to happen, how we are going to live, and they lost their jobs. So it's definitely a race on all the stressors. So therefore, people were way much more going through crisis. We can definitely see and work intensively with the community market delivering food to neighborhoods, so they don't even have to go and drive to a food bank nearby. So we were helping to reduce at least the stressors. We made sure that they have a meal for their family, for the every day. We try to connect them with financial services. So those programs that, this valley have a lot of nonprofit trying to help. So we were just a point of contact trying to assist on the application, and we saw a lot of people coming back to us, sharing their stories and thanking for what we did, and also for the partner organization on connecting with the existing resources. So we also started, I remember this January 2021, we had a pilot, like, let's try telehealth, mental health via telehealth. There is also a misconception that, technology barriers, we have a lot. So MIRA is equipped to have this telehealth service. So we tried that, and we start calling people on our list that they came in the past, and they mark as a need that they want to talk to somebody. So we follow up with them if they were connected with services. So we started this pilot where we saw we saw an overflow of people coming our way to connect it to a mental health provider that will be bilingual via telehealth. So definitely is a potential to continue doing at the MIRA, because we think that people are getting used to Zoom meetings or digital meetings, and they came back to us asking for more sessions. So definitely people we saw an increase on mental health issues, and also substance abuse with this program, and also the diabetes and heart health program. We are seeing more men at the bus. And also we are identifying some substance abuse, which is also very common in the Latino community. And that's addressing those issues. We were able to connect them with the navigators, the behavioral health navigator, or other providers that may have the resource.
Awesome. Melina, thank you so much. Okay, so we are running up against the clock, running out of time, but I really want to thank you all three of you, for your amazing partnership throughout these past few months. It's been wonderful to work with you. You're all doing such amazing work in this community and really making a huge difference in people's lives. There's so much more that we still need to do to address the behavioral health of the Latinx population in our community. But certainly the programs you provide help fill such huge gaps, and we couldn't do it without you. So thank you to our panelists and attendees for joining this discussion today. The EVBH, or Eagle Valley Behavioral Health model, is one that can be replicated in communities like ours across the community. And we really want to encourage everybody to visit the ittakesavalley.org website to learn more about the fundraising campaign, to make a donation, or to sign up for the foundation's e-newsletter. So thank you all for joining us today again, and I hope you have a wonderful day.